Welcome to the Dose of Good podcast, where we celebrate good people and organizations working to make the world a better place. It can be easy to get caught up in the bad things going on in the world and forget about the good happening all around us each and every day. I'm your host, Erin, and I want to share these stories with you and give them the attention they deserve. I hope this podcast educates and inspires you and maybe even motivates you to share a dose of good in your community. Now let's get into today's episode. Today I'm speaking with the co-founder and the executive director of YouthWell New Hampshire. This is an organization that I originally was not familiar with, but was looking for more youth organizations to have on, and this one came up in my search, and I'm very glad that it did because these women are very dedicated to helping youth mental health in New Hampshire, and they are doing wonderful work. I do want to let you know that there is mention of suicide, so that you know that before going into this episode. But I really enjoyed my conversation with them. It was very engaging, and I hope that you enjoy today's episode. Let's get into it. So today I have with me Tricia Brannon, Executive Director of YouthWell New Hampshire, and Beth Crake, Co-founder and Board Chair. Thank you both for being here.
Thanks so much for having us.
Could you tell me the mission of YouthWell New Hampshire?
Yes. The mission is to positively impact and improve the mental health of young people, of all young people in New Hampshire.
Okay. And as co-founder, what made you want to start the organization?
So my husband and I have, for our entire adult lives, been involved in youth activities. I was a teacher for 22 years, a high school teacher. And over that time, we saw a lot of kids, met a lot of kids, great kids. And we're finding that more and more kids are really struggling. We're seeing rates of depression and anxiety and just overall angst among our young people. And we wanted to do something very sort of proactive in that area. And so we thought, well, this might be the way to do it. You know, I'm on a couple of boards, the Boys Club and the National Education Foundation, and those things definitely are, you know, youth serving. But this was a direct way to get to youth mental health issues, which we thought were so important.
Yeah, definitely. Well, that's great. And how did you get involved?
So I got involved. Beth and I go way back. We have been dear friends since 7th grade. And when I was a young person, mental health, mental illness was not something that was really discussed. And I have lived experiences, and personally, it was very lonely and isolating. So I also was a school counselor for several years. And when Beth and Brad decided they wanted to take this journey on, they asked me if I would be a part of that, and I was honored to do that. They asked me if I would help establish the nonprofit and then run the day-to-day operations. And because of my lived experiences, my work with young people as a school counselor, just my own personal life and watching my children grow up and the things that they were going through, I'm just really passionate about youth mental health and doing anything that we can to positively impact and improve it and help them, to be well and to thrive in their futures.
And what organizations do you support?
So we support schools, other youth-serving organizations. In the fall of last year, we had a inaugural small grants program, and we put out a proposal to to receive proposals, and we had 80 applications of over $875,000 worth of need for youth-serving organizations around mental health.
At that point,
and wellness.
we were not even a year old. We didn't think anybody knew who we were.
Yeah.
We didn't have any idea. We knew that there was need, obviously, but we had no idea it was going to be like that. We didn't even have our 501c3 yet. We just wanted to get started.
Sure.
And we were just overwhelmed by
Wow.
the numbers.
So some of the programs that we were able to fund, and we were very honored to do that, the Granite State Children's Alliance, their Nashua Child Advocacy Center, they have a behavioral health program within their centers, and we were able to help fund that program to have a behavioral health provider within the child advocacy centers. We have been able to fund youth mental health first aid programs, school programs, one in SAU 21, which is like the Hampton, Seabrook School District. That is mental health coaching for families. Youth mental health first aid, again, training for camp counselors at the YMCA Southern District at Camp Lincoln. Hampstead School District, they have a school program that they wanted to incorporate. It's along the lines of Connors Climb Foundation is another youth-serving organization. It's they have a Stick It to Stress program, and then a regulated classroom program where teachers get trained in how to provide how to work with young people who are having behavioral issues in a regulated classroom. And then mental health awareness training and a children's intervention program, which is a partnership between Riverbend Mental Health Center and the Community Head Start program, where a mental health clinician from Riverbend will actually go into the Head Start program to do observation and consultation so that early intervention can happen. So the earlier they're able to intervene with mental health issues, obviously the better success and future success for the young person.
Well, the answer really is we will work with anyone that is youth serving and in this area. We've found that individuals have come to us,
Right.
As well as schools and organizations. So it's really everyone.
Well, that's wonderful. It sounds like you're already making a big impact in a lot of different areas. So that's
We hope
great.
so.
We hope so, yes.
Yeah. And could you tell me about the village and how people can get involved with that?
Sure. Well, Beth created that.
It's our little volunteer group.
It is our volunteer group, the village, and really what it is, people can sign up to join the village, and we were also very honored that we have a great group of people already. And when we have a need, whether it be helping on an event or stuffing envelopes or, maybe some help with social media or just anything, we reach out to the village. Whoever has that skill or is interested in helping on whatever that particular task is, they can say, yeah, I'm interested, and then they can help us with whatever the task is at hand.
We were also really, we had an inaugural event where we sort of let people know who we were. And so many people came to us and said, I want to do something. And that's why we felt it was important. But it's not necessarily I'm going to volunteer every Tuesday at YouthWell. It's when it fits your schedule and we have something that works for you. So it's nice. It gives people a chance to get involved.
So if someone wanted to become a part of the village or help volunteering, would they email either of you? Or
Yeah, there's a link on our website for the
Okay.
village where you go and you sign up, and that way we have all the information we need. And yeah, it's real simple.
Yeah, we have
Great.
a Get Involved page, and the
Okay.
village is on
Wonderful.
there. Yeah.
And this is kind of a two-part question, but why do you think there is kind of a mental health crisis among New Hampshire youth? And would you say this is more of an issue today than in the past? And if so, why do you think that is?
Yeah, I think that, it is a two-part question. I think that we are much more aware and much more willing to talk about the issue, but there certainly were issues, in the past.
Sure.
Tricia's very well versed in how this has happened.
Yeah, so, I mean, in 2022, the U.S. Surgeon General declared, like a state of emergency for youth mental health. And every 2 years, there is a survey that goes out to New Hampshire schools, the New Hampshire Youth Risk Behavior Survey. And it goes out to schools all over the country. And they ask questions about risk behaviors for young people. And even before, so I think the pandemic was one factor, but even before the pandemic, we saw a rise in anxiety and depression, suicide rates, and so forth. And I'm going to put that aside for why that is, but if you look at the statistics, they're staggering. And in New Hampshire, suicide is the leading cause of death for those age 10 to 14. And it's the second leading cause of death for those ages 15 to 34. Now, when I say that, it just is, I can't believe it, and it's just so devastating. LGBTQ plus youth are 4 times more likely to attempt suicide than their peers. And we really need to help these young people to not feel like that is their only choice. We need to give them a sense of belonging and help them, on their life's journey to be successful. So according to the 2021 New Hampshire Youth Risk Behavior Survey data, and I think these statistics are just really important, so I'd like to share them with you. More than 44% of students reported persistent feelings of sadness or hopelessness. And that's just not feeling, blue or sad. That's persistent for a 2-week period. 24.7% of New Hampshire high school students seriously considered suicide. It's terrible. 19.3% made a plan for suicide, and 9.8% attempted suicide in the 12 months preceding the survey. And for LGBTQ plus youth, those percentages are even higher. The 2023 New Hampshire Youth Risk Behavior Survey data just came out, and the results are not any better. So there is a serious issue, and we need to help our young people in many different ways. Like I said, I think the pandemic was a factor, but even before that, I think the rise in smartphones, technology, and social media really is where, if you look at the research, that's really when the spike in these mental health issues happened, was right after the smartphone came out in around the mid the 2010s time frame. So, and that's a big issue right now, and we're trying to, work towards solutions around helping educate parents, helping educate young people on the detrimental effects of smartphones and screens on their mental health physiologically. The physiological effects and that are then contributing to their depression, anxiety, and many other mental health conditions.
So the phone itself, the smartphone, is actually affecting their brain and the way.
Yeah, if you read the studies, and it actually starts when they're very, very young. You've been in a restaurant where you've seen the kids at the table with the tablet.
Yes.
And it's the problem is that at that young age, their brains aren't able to sort of handle the dopamine hits that you get.
Sure.
That you and I get
Yeah,
when we're on our
yeah.
phones.
Oh.
And we are not, screen, haters. Well,
Yeah.
They are a phenomenal tool, and they're a phenomenal tool for kids as well. However, it's got to be at the right time because their brains are still developing, and they can't handle just that those dopamine hits.
Sure.
Then it moves into, as they get older, the screens bring them the social media, and that's when when you read some of the. I don't know if you're familiar with Anxious Nation, the book by Jonathan Haidt that
Anxious Generation.
Anxious
Yep.
Generation,
Mm-hmm.
that he basically outlines the fact that these kids, boys in particular, the screens, the gaming causes these changes in their brains. And with the girls, it was more the social media, the Instagram, the feeling less than, comparing themselves to what's not even real
Sure. Yeah.
out there. And that has been a huge contributor. So the whole thing started to turn around 2010. And then by 2015, that's when every kid started having one in their hand.
Sure. Yeah.
We liken it to, and we're sort of proponents of getting these things out of schools at least, so that even the academic part obviously has been affected. But it would be like if you and I went into school and sat at our desk and we pulled out our computer and our TV and our stereo, and all that was just sitting on our desk while we're trying to learn. I mean, we'd get nothing done.
Right.
And that's what's happening. And so the idea is, and we're having a series of events in the fall addressing this issue. The idea is there's got to be a time where kids can put this away
Yeah.
and just focus on school and focus on their own relationships.
Yeah.
A high school cafeteria at lunchtime right now, it looks very different than it did when we were there, and even when you were there, I'm sure, because they're sitting there and they may be talking to each other, but they're talking to each other while they're looking at their phone.
Oh, yeah.
It's constant, and it's
Yeah.
an addiction, and we all know adults who are addicted, but for these kids, it's so difficult for them to let go.
Yeah, well, I've observed it myself. I work with some middle school students doing video production stuff and that. And even this summer, the camp that I worked with, the kids, the second they have any downtime, that phone, even though I tell them not to, it's hard to keep them from it.
Yes.
But they take out that phone, and it's like they don't know how to talk. Because like at lunch, they're all on their phones. Not even. I'm like, don't you talk to each other?
No, they just show each other what's on their
Yeah,
phone.
exactly. And
Yeah.
it was kind of eye-opening. I'm like, wow, this
Yeah.
is, and it is an addiction, as you said.
Yeah.
So
It's our hope that we're going to focus our fall series on. We're hoping to talk to elementary school parents.
yeah,
The parents that are dealing with the high school kids. Not that ship has sailed, but that's really ingrained, and that's hard. If we can
Right.
get this group of parents to, as a community, say, we're not going to give them a smartphone until they're out of middle school,
yeah,
and they're not going to get on social media until they're at least 16. If everybody can come together and say that can make a difference. The problem is if your friend has one and you don't, you're saying to your mom over and over, but Susie has a phone. Susie has a phone. Everybody has a phone but me. And you don't want your kid to be the one that's ostracized, because that's where the plans are made. That's where the socializing is happening.
Right.
So it is a very difficult thing for parents. But we're hoping to give them some tools and strategies so that they can come together.
yeah.
Because it's got to be a community effort. Everybody's got to agree, hey, we're not doing this, so that kids can have a fighting chance against this stuff.
Oh, yeah, that is hard. And I, believe it or not, have thought about it. My son is 6 months old, but I think about when he's older, I don't really want him to have a phone too young.
Yeah.
But at the same time, it's that well, then he's the only kid without a phone, and then
Yes.
he's picked on because he's
Right.
the weird kid without the phone.
Right,
So
exactly.
I'm hoping you're successful with this and kind of starting a new trend of not all the kids having a phone.
Yeah.
And that
As a
sort
new
of
mom,
stuff, so.
we'll send you some stuff to read. It's
Okay.
about those first 5 years even they're talking
Yeah.
about with the screens. It's it's not that it can't be at all, but it's got to be limited. And
Yeah.
and there are tools, and it's funny, I have some grandkids that are, pretty addicted to those screens, and even the act of trying to get them off of it becomes a struggle with a parent.
Yeah.
When you have to say, okay, it's time to get off. It's time to get off. And you're having this, and it's a battle, and it becomes exhausting, obviously.
Yeah.
But it's not their fault. They're being,
Right.
that dopamine hit, and then add into it the algorithms that some of these
Oh, yeah.
these companies have that know exactly what they need to do to keep your kid right on that device.
Well,
So.
please send that to me because I would definitely love to read it. And I've read a little myself in that I know it's going to be difficult and people will probably think I'm overdoing it or something, but I hope to not give him any screens, like, a tablet or something like that of his own, because from what I've read, up till 2 years old, they don't even really know what they're watching
Of
or
course not,
process
right?
it, but it does. It is stimulating.
They're
to them,
looking for
and
that
then they'll
changing color and change
Right,
that
and
content
then
every 3 to 5 seconds.
It can
something
even
new.
cause behavior things because they're like,
Absolutely.
I'm looking for that. Why can't I have
Yep.
that? So
Yeah.
I'm going to try to stick
Yes.
to it to not
And I
introduce
get it.
too
It's
much of
hard.
it.
It's
Yeah.
hard. You want to go out to dinner and be able to have a conversation.
Right.
And,
yeah.
you put that in front of them and they're going to be quiet and they're going to
Yeah.
watch it. But they're also not going to be picking up on a lot of the things that we all picked up on around a dinner table.
Right.
That are important.
Yeah, and I'm hoping he'll more use his imagination to play, and like from even before he was born, we read to him every night. So I'm hoping
great.
he'll be a reader with
Yep.
books and all of that
Absolutely.
stuff.
But also sitting at dinner and having a conversation is
Yeah.
really important, and those are skills that a young child can learn for
Right.
that will benefit them in the future, and being able
Definitely.
to have a lot of different conversations during that time.
Sure. So I know this is a lot, and it's more than one organization or one group of people can take on. But you've mentioned some things you're planning to do, like going into the elementary schools and that. But what do you think can be done, at least here in New Hampshire, to help with this mental health crisis, I guess?
I really believe that education, prevention work, collaborating with other youth-serving organizations. In Manchester, an organization called Making It Happen has assembled a youth wellness and prevention collaborative, which brings together youth-serving nonprofits from the greater Manchester area every month to talk about these things and how are we going to help our young people with the mental health issues, with substance abuse issues, and it's really geared toward prevention work and education and working together as a community to.
And Tricia's also got her finger on the pulse in Concord with state legislature. And there's a lot that can be done
Sure.
in that way. We were on a walk yesterday and we were talking about the fact that, lots of times when you're talking about the phones in school, the parents push back. I want to be able to get to my kid. I want to be able to talk to my
Yes,
kid.
that's-
And if we needed our parents when we were in high school, we went down to the office and we told
Right.
them, and they called if they thought it was a valid. If sometimes you found somebody else to give you lunch money, or you borrowed your friend's gym shorts because
Right.
that's what was happening.
Right.
Now it's mom and dad are so right there, being able to solve all those problems.
Right.
But so districts, though, it's hard for them to be able to implement these rules because they've got parents pushing back.
Right.
But we say we're not going to give you alcohol until you're 21. We're not going to give you keys to a car until you're 16.
Right.
Right.
We have laws. We have rules. This can be one. So
Yeah.
there is some push, at the state level to, make, hopefully, and in other states, hopefully, make some guidelines and have some legislation that can help parents say, a parent who doesn't, we wouldn't give your kid a beer. Well, I can't,
Right.
it's against the law.
Yes,
I can't have that phone because it's too early for you to have a
Right.
phone.
Right.
Yeah.
So
Yeah.
hopefully that's one way.
Right.
Yeah.
Yeah, absolutely.
Definitely.
Absolutely.
I guess that's pretty much what I had planned to ask. So is there anything we haven't covered that you would like to talk about or share?
Well, Tricia maybe wants to share what we're going to do this fall. That might be helpful.
Yeah.
Yeah, so this fall we are presenting a 3-part series called Beyond the Screen, promoting positive mental health for New Hampshire youth. And it's for anyone, but like Beth had said, we really wanted to target elementary school parents and students, but it is open to all parents, all students, teachers, and others interested in youth mental health and to learn more about the effects of screens and smartphones, social media just in general, and also the effects of them in schools. So we have an event. Our first event is Thursday, September 26th, and that's going to be held at Nashua High School North at 6:30, and we will be screening the film called Screenagers, Growing Up in the Digital Age, the Elementary School Edition. And it will be followed by a discussion with the film's producer, Lisa Tabb. Screenagers was created by Dr. Delaney Rustin out of Washington State. And she had seen many young people coming into her pediatric office who were suffering from anxiety and depression, and it was like not all of a sudden, but kind of like all of a sudden during this period of time, she had all these young people, and she wanted to understand what was happening.
Yeah.
And so she did a lot of research around what was going on with smartphones and screens and so forth. And she was also concerned about what was happening with her own teenage daughter. And so that's how the films were created.
Okay.
So that's the first event. And then the second event will be Thursday, October 24th. The location is to be determined. And that will be the sequel film called Screenagers, The Next Chapter. And that really does delve into the mental health issues around screens and some solutions for parents that they can, take with them. Mm-hmm. Following that screening, we'll have a panel of experts to have a discussion about how screens affect New Hampshire youth. And then our final event will be November 21st. And that's really a discussion about a culture shift. And it'll be an expert-led discussion about how we can make some necessary changes on how we deal with phones in schools.
Okay.
And we're hoping to have school personnel, superintendents, principals, and other experts in the field who understand, the impact of smartphones in school and how it's affecting, teachers' ability to teach, students' ability to learn, and just young people's ability to interact with one another on a personal level without that screen in between. So that is that 3-part series, and we're hoping to have a very successful discussion, and we welcome all to join us.
So do people need to register? They can just show up for those events.
So we will have a registration. This is
Okay.
free
Okay.
to the public. We will have a registration.
It'll all be on the
It'll
website.
be on our
Okay.
website, on our social media, and we will be sending out email blasts to contacts from our mailing list and so forth.
Okay, wonderful. And then 2 questions I like to ask everybody that comes on. The first, which nonprofit should we feature next? And if you need to mention
Yeah.
more than one, that's fine. Whatever.
Yeah,
Oh, don't get her
I know.
She has volunteered for all of them.
Oh,
Yeah.
wow. That's
Well,
amazing.
gosh. So I had already told you about
Yes.
Media Power Youth. I just
Yeah.
think that would be a great connection
Yeah.
for you in
Yeah.
what you do here. But Friends of Anya is a organization in Manchester that provide grief support for young people and their families. And it's an amazing organization that really helps young people through their grief in a peer support atmosphere. So there are adult facilitators, but the groups are really peer led and peer supported, and it's very impactful.
Yeah, that sounds great. I'll definitely reach out to both of them.
Yeah, and I'm a boys club, girls club person,
Okay.
and there are so many in the area that you could reach out
Yeah,
to. That
I
would
haven't
love
had
to-
them yet, so that would be a
Yeah,
good one.
well, so I'm on the board of the Nashua Boys and Girls Club, and it is a phenomenal place, and they do so much for our kids, and the executive director there, Craig Fitzgerald, is a club kid, and he's come back and he's running. He's a good story. He would probably be great for
Oh,
you.
that'd be great. Yeah, I'll definitely add that to the list. Thank you. And then the final thing is, what is the kindest thing you've witnessed or been a part of?
With respect to YouthWell, or just
In general.
In general.
Or you could do a YouthWell and whatever you feel.
Well, for YouthWell, I guess when I started out in this role, the way I was embraced by other youth serving organizations and other organizations who, their mission is around mental health, and just other nonprofits. They embraced me. They educated me. They shared their knowledge with me. They collaborated with me. They partnered with me. They just were so welcoming and wanting, to give all of what they could, to us so that we could be successful. And I thought that was really remarkable.
Yeah, that's wonderful to hear.
Yeah, for me it was when we were getting started, we reached out to a young woman who is from Nashua, and we just wanted to ask her some questions about what she had been through. She was involved in a program that Tricia's really involved in, Magnify Voices. It's an art installation where kids can submit artwork sort of discussing their mental health, and it can be paintings or films, whatever, and probably another good,
Yes, I know. Yes, Magnify Voices.
yes, would be good with you. But this young woman, Mia, was shared her story of her struggle with anxiety, and she ended up coming and speaking at our inaugural event where we were introducing ourselves. And honestly, listening to her, she told a story about how there were other kids that came to the program, and how she then took them in and helped them with their struggles. Her kindness was really what affected me. She was a kid who had her own stuff, but yet took the time with the others that were struggling in the same way.
That's wonderful.
Yeah. As a matter of fact,
Absolutely.
Mia left for college yesterday. She's
my
going to
gosh.
Syracuse
Oh,
University.
exciting.
Yeah, she's a remarkable young
Yeah.
woman. Very special.
Oh,
Yeah.
very nice.
Yeah.
Well, thank you for sharing that, and thank you so much for being on the show today, and thank you especially for all the great work that you're doing for the youth and their mental health. It's really needed, and I appreciate it very much.
Thanks so much, and we appreciate you giving us the opportunity to chat with you.
Oh,
Yes,
no
thank you so much. It
problem.
was an honor to be here.
You're welcome. Thank you. I hope that you enjoyed today's episode about YouthWell New Hampshire and learning more about this incredible organization and the women behind it and helping it to run, and all of the great work that they are doing to help youth mental health in New Hampshire. As you've learned over the past 2 episodes, mental health is a big issue right now in terms of people battling anxiety, depression, and just kind of feeling overall hopelessness. So these organizations are more important than ever, and I'm happy to be highlighting them and hope to let more people know about them. So please share the episode so that more people can find out about YouthWell New Hampshire. I hope that you'll check them out for yourselves. If you're local, maybe become part of the village. And I thank you for listening. Be sure to leave a review on Spotify and Apple so that more people can find the podcast. And I'll talk to you in the next episode.